Why does it feel like your doctor is rooting against a root cause approach to treating your autoimmunity? Well, today, we want to explore why conventional medicine docs steer you away from that functional medicine approach. And we have an A team panel of physicians led by our own Dr. Maggie here to dive into this.
Well, today I have a confession to make. And in fact, it was my biggest shame as in my career as a physician. And you're not going to like it. We're going to dig right.
Hearing you talk about that confession, Dr. Maggie, I think a lot of people interested to hear more about that. I'm your co-host, Anne Emanuel. Thank you, everyone, for joining us for Autoimmune Table Talk Live. Really kind of striking a somber tone. I know today's topic gets you both fired up and emotional.
Yes, yes, and hell yes. I'm Maggie UMD. I am a functional and holistic medicine physician, and I created the Transform protocol to turn around autoimmune disease naturally. We, in fact, are celebrating this week our Facebook group, Transform Autoimmune Disease Naturally, hitting 60,000 members. So if you haven't joined our Facebook group, make sure you click the link above or below this video and join our Facebook group where you can catch us live. If you are watching this from YouTube, make sure you click the thumbs up, give us a subscribe, ring the bell so you get notified every time we go live. Today, we have a hot button topic. In fact, this question was in the Facebook group earlier this week, and we talked about why are conventional doctors so dead set against a functional or root cause approach in dealing with autoimmunity? And I think we're up to 300 plus comments, and it was a rager.
Got so much feedback on this. And if anybody's watching right now, please let us know, what do you think? Why do you think your doctor is against this approach? And what have you heard your doctor tell you about why you shouldn't go down this path and why you should only stick with conventional medicine?
Yeah, and I'd love people in the audience right now. If you're an alumni or you're in one of our programs, I'd love for you to let people know. Tell us what autoimmune struggles you're struggling with. Tell me one big aha you're learning from the program in there. Be my student teachers in the chat and actually tell us one thing that was huge for you that you're learning in the program. For those of you that are watching who don't know much about me, make sure you join the Facebook group, but do tell us in the comment section, what autoimmune struggles are you struggling with? And I would love to hear the one thing that you've heard from your physician sometime in the last 10 years in dealing with your autoimmunity that makes you mad. Put that in the comment right now. And I'm guilty of saying those things myself. And we're going to lead into this. And
First, you mentioned that you have this, and it's a shame that you feel on yourself. Of course, you have more than made up for it. You've helped so many people, but this is something that kind of haunts you about your previous medical path.
Absolutely. And so I think the biggest thing about this is that I think out of the 300 comments that we've gotten in the Facebook group on this question, I mean, people are just the go-to for conventional. We call conventional doctors your regular primary care doctors or the specialists that you're dealing with. And the biggest disdain that people get is that their doctors will say, has tons of objections to it, will say it's a scam, it doesn't work, and talk them out of it, or dismiss what people are bringing up to them. And I find that the vast majority of public is actually getting educated about root cause approach of functional medicine, not from their doctor, but from their own research and from them watching videos just like this. And then when they bring it to their doctor, they are met with nothing but obstacles, right? So this is the crux of the problem. And I would say that in our program, we talk to at least about 100 people every single week. And we hear this all the time. And we have some heartbreaking case examples that really made my blood boil, which was why we wanted to do this panel today. And I was like, why don't we give people a behind the scenes look at what do functional medicine practicing, the top docs that are practicing in functional medicine, what is the behind scenes of how we have to deal with our colleagues? What did we do before we became functional medicine doctors, and why did we become functional medicine doctors? This is a very rare, unique behind the scenes look from behind the trenches that you're never going to get anywhere else. And I have the top docs on the planet, people I like, just these are colleagues I love. So I would love to bring them on and have them introduce themselves and get this panel on the road.
Let's do it. Bring them on in. So excited to be joined by these doctors today because I know you have so much love and respect for them and can't wait to hear from them.
Okay, so we've got some top docs here, and I'm going to ask each of them to do a quick introduction to tell you why I think they're so great. So, Rob, I'm going to have you get started. Dr. Floyd.
Hi, my name is Robert Floyd, double board certified MD and a functional medicine physician, certified physician. I've was fortunate enough to meet Maggie at a training session, and she told me what she was doing, and I was just blown away of her success. And I really kind of wanted to emulate it. And one of the reasons that I kind of went towards functional medicine is because I'm kind of an outside the box thinker. And, having spent, the best part of the last 15 years in medicine, I'm looking at it, and to me, it's just like, putting Band-Aids on severed limbs. It's a little too little and a little too late. And unfortunately, it is what we're all taught in medical school is diagnose and treat, diagnose and treat, diagnose and treat.
Yeah.
Well, it's much deeper than that. And you are not a lab value. You are not a disease. And so what I liked about functional medicine was that I could look at everybody as a whole. And I ask, my first intake is 90 minutes. I ask about their diet, their lifestyle, their exercise, social support, spiritual support, everything that makes a person a person. It's not just, hey, your TSH is off.
Yeah.
And, coming from, I've had extensive training. I did 2 years of trauma surgery and critical care training in Vegas. I then did family medicine. I then did emergency medicine and hospitalist. And then I moved into my own integrative practice. And thank you to Maggie, shout out to her again. She really prodded me to get into this space, the online space where I can make a bigger difference and help more people at a time. In a clinic setting, I can only help one person at a time. In this setting, I can help, tens of thousands. And, again, thank you very much, Maggie. I appreciate you prodding me to go this direction.
And Robert, I mean, you're really shaking things up with your metabolism program, helping people with their metabolism. And there's so many functional root causes of that. So he's top doc metabolism. And next we have Chris Winfrey. Dr. Winfrey.
I'm Dr. Winfrey. I'm a psychiatrist in New Jersey. I practice functionally integrative approach, kind of bring in everything I can to help people who are struggling with neuropsychiatric problems. I met Dr. Maggie when I saw a couple of her online videos. She was quick, witty, spicy.
For sure.
You're making me blush, Chris.
And so I had a couple family members that I thought would benefit. I was trying to help them get on this path. And I said, you know what? She has a structured program. I thought they needed some structure and some guidance and things. Sent them to her. And it really was helpful, giving them a really good foundation and things to spring forward and to do because they were feeling really lost and hopeless. And although I was a trusted family member, I was still part of the medical community, which they were still trying to wrap their heads around what I was saying. So it was great to have that intervention from them. So thank you for that. I got to functional medicine. I always just felt that medicine I was practicing before, I was doing it as a formality, going along with what I was told. But I didn't think that it was the full picture. I always felt that something that was missing. And I just always continued to follow that intuition. And I kept my ears open, and I would hear somebody say one thing at one point or a conference, and it just kind of spurred to I got to the point where I'm at now. Certainly my own health challenges brought me further into this space to kind of dig deeper and kind of figure out ways that I could better advance that. So that's how I got to this space. And I'm happy to be in this space. And I think it's a great transformative experience for people willing to embark upon it.
I mean, and Chris, I've known you several years, and to watch you transition from traditional psychiatry into practicing functional psychiatry every day has been super rewarding. And I know that was your dream, and you're there.
Yes, absolutely.
I love it. And then Senya, a lot of people don't realize that acupuncturists and how they can become functional medicine providers. I'd love for you to introduce yourself with that.
Yeah, so I have a doctorate in acupuncture and Chinese medicine, and I've been doing that for 14 years. Before that, I was an engineer. I was a biomedical engineer, so I have a very scientific background. and was practicing a lot of holistic medicine with Chinese medicine, which is fantastic. But I really felt like I was limited in how I could treat autoimmune conditions with Chinese medicine because it's very reliant on acupuncture and herbal medicine. And there's so many like underlying causes that contribute to autoimmunity. And if you're not doing some of the lab testing, you're not getting that objective information. So we can guess and we can try some things out when you're doing that holistic approach. But if you can truly get that data, then you can really refine a treatment for somebody for the long term so that they can have, they know what their food sensitivities are because they've done food mapping. They can use that for the rest of their life. Like we can look at what their hormones are doing and balance those, and they have lifelong benefits from that. So I really wanted to kind of pull some of the science back into the holistic medicine that I was already practicing.
Right.
And Maggie and I, so we also met at one of the IFM conferences, and Dr. Floyd as well, all three of us, I believe we're sitting together. So
Table 12.
At Table 12 in Seattle before the pandemic.
Right.
And I was so impressed with Maggie's program because I could see how many people you were helping, and I really wanted to know how you could make such a huge impact. Because again, I'm a private practitioner I'm in St. Paul, Minnesota. And then I was very fortunate because as part of my doctorate training, I reached out to Maggie and said, hey, so they want us to do something that's not acupuncture and Chinese medicine. I want to do functional medicine. Can I intern under you? And she said, heck yeah. I mean, she called me up within an hour, like, yeah, let's talk about this. How can we do this? And I got to spend months just learning from her and absorbing everything that she was doing. It's such a mind-blowing program that I emulated. I use it in my practice today.
So I want the audience to understand that we've got an internal medicine doc with Dr. Floyd, who specializes in functional metabolism work. We have a functional psychiatrist with Dr. Winfrey here. And then Senya here, Dr. God, how can I pronounce your last name?
Say my first name. It's easier. Just call me
Senya. Dr. Senya here is a functional acupuncturist. Did you know that there's all these different types of functional doctors, right?
Nope.
Functional medicine doctors who've actually received accredited training in functional medicine. And this is blowing your mind.
It is absolutely blowing my mind because you wish that you had access to in your own town to people like Chris and to people like Senya and to people like Rob. And luckily, many of you are now reaching out and doing work, like you said, in the online space because it's so needed, because you just don't get, like you said, you don't get that personalized care that you would get with a functional medicine practitioner. And so very interesting to hear you, Dr. Senya, talk about you're doing the testing now, because I visited an acupuncturist myself and never did she test. She talked to me about some things that might be cold or some things that might be damp and things like that. But from a patient standpoint, you don't always understand that either, so I'm sure you're able to connect with your clients in a much better way now.
Absolutely. And the terminology in Chinese medicine is just nothing that's really going to take off in America. A lot of qi and blood and yin and yang, and it confuses everybody. But you start talking about inflammation and hormones and food sensitivities. People get that. They intrinsically understand it. And I feel like it sticks a whole lot better.
I agree. So I want to actually dig into how, before and people in the audience, a lot of them know my story, is that I, as a result of my own illnesses, really dove into, quite by accident, the world of functional medicine. This is 20 years ago. And so it was before there was even what we call functional medicine, right? And so for me, I recall, and I'm going to talk about, what did I say to patients when I was a practicing family practitioner, a good one and a caring one, when they came to me asking about root causes. So I would examples, and I'm sure it resonates with all of you guys. I would have a patient and I'm treating people for high cholesterol, high blood pressure. And they come to me and say, Dr. Yu, what do you think of red yeast rice? And I'll be honest, the only training I got out of all my 4 years at UCLA, one of the top medical schools in the country, I did residency for 3 years after that with UCLA and at Kaiser. And then I was a practicing physician for years after that. All that training, do you know how long total I had in learning about supplements, nutrition, or alternative medicine? The total, Senya, was 30 minutes in that entire period of time. So no wonder, when people came and asked me for it, people come to a regular doctor, their family doc, their psychiatrist, their internist, their acupuncturist. They come to you, they come to us, and they think, we know everything about this, and we're here to give them an educated answer about this. And my answer was, there's no data behind it. And the reason I said that was, to protect my, I was told to protect my own hide, because we have what we call standard of care when we practice medicine. And the standard of care for someone with high cholesterol is you got to give them a statin. You have to give them medication. We're drilled into our heads. Evidence-based medicine is that you have to give everybody a statin for high cholesterol. And if you don't talk about it, you don't sell it as the first and only step, you could possibly be sued for malpractice because you're not practicing standard of care. Mm-hmm. And so as a result, we were taught to say anything that wasn't, and what is the evidence is paid for by large pharmaceutical companies, millions and millions of dollars to give us those results. So we can say, we have evidence that this $3 billion study says that the statin is what you should be on. And unfortunately, there is no evidence. There is no, like, red yeast rice is a supplement, healthy diet. There's no $1 billion industry behind it to say, I'm going to fund a $2 million study to say red yeast rice works, or that, dealing with your adrenals work. Nobody's funding those studies because there's no money to be made on the other end of it. There's not a $1 billion drug to be made out of that research. So as a result, as a physician, I could confidently say there's no data behind it, so it doesn't work. That's not true. There's no $1 billion industry to fund research behind it. Therefore, I don't know if it works or not. That's really the correct answer. But how many of us hid behind that answer and really did a lot of disservice, dismissing a lot of this stuff that actually works and dismissing our patients as a result? I'm going to ask you guys for that.
Well, I'll go ahead and follow up with that. At least, Maggie, you got a half hour of nutrition training in your medical school. I got zero. Zero.
Fact, everybody. Fact. Thank you for that confession. Right.
And actually, in the average amount of nutrition training in American medical schools right now is less than 1/3 of 1% of the curriculum. And
which
only
means less than an hour.
Yeah. Only 28% of US med schools have nutrition programs in the curriculum. It's ridiculous. And, Maggie, you brought up another good point about evidence-based medicine. I hate to say it, it's garbage. It's been proven that all of the journals and all of the governing boards are all bought by Big Pharma. There was a study a couple years ago that showed that the journal from the American College of Cardiology, they have 17 editors. Okay. The editors are responsible for what's going to get published and how it's going to be published and so on and so forth. Right. Every one of the 17 editors of the American College of Cardiology journal was receiving large sums of money from Big Pharma in the hundreds and hundreds of thousands of dollars a year. So they are not going to allow studies that poo-poo Big Pharma drugs into their journals because, there's a good company. I like Green Med Info. If people are out there looking for different information, that's evidence-based, with lots and lots of research behind it. They talk about a lot of the evidence behind what we do.
Correct.
There
is tons of evidence actually, and growing amount of research that functional medicine is actually evidence-based.
Absolutely. And, the father of it, Jeffrey Bland, he's been talking about leaky gut for 30 years. There's data, and NIH, PubMed, there's data and studies of leaky gut. Alessio Fasano, who is like the godfather of leaky gut because he came from Italy and tried to make a cholera vaccine, failed miserably. But because of that, he found zonulin protein in the bloodstream. Okay. So real quick, I know I'm using a lot of time, but real quick, this is important. When people are really, really sick, we get this thing called bacterial translocation. When they're, really sick in the ICU, the bacteria translocates from the inside of the intestines through the intestinal wall into the bloodstream, and people get septic and die. That right there is leaky gut. Okay. And that's been known for many, 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 many years. And so the reason I'm in this program and in this realm is because I looked at what was going on and I'm like, this isn't right. I need to do better for my patients. So
Chris, what do you think? Because you're a psychiatrist, and do you feel like your hands were tied having to deal with, you had to talk about all these medication drugs first and sometimes as the only option?
I used to brag that kind of feel proud, if I knew all about the drugs, and if I had somebody on 3 and 4 and 5, 6 drugs, and
we aced pharmacology, dude.
Yeah, it was great, and they didn't necessarily have to get better. I just kind of I had to be able to get the right diagnosis and get them on the treatment, and it didn't require them to get better. And I think that was kind of the drop off for me. I'm a person that want to see people get better. I'm not okay with just managing them and giving them what I like to call palliative psychiatry.
Explain that palliative psychiatry. Give me that. Expand on that.
I think it became crystal clear to me. One of the patients that I'm treating right now, she's doing exquisitely well when we switched over and took a functional integrative approach. When I was treating her early on, she had told me that she was diagnosed with borderline personality disorder. She was diagnosed with bipolar disorder and multiple sclerosis, and that she was going to have to live with these lifelong conditions for the rest of her life, with these conditions for the rest of her life. Right. She was 19 at the time. And as I was just listening to her, it just kind of dawned on me in that moment. She's 19. The average person lives around 70 or 80. If she's lucky, super lucky, she'll get to 100. So let's just, for math's sake, let's say she's 20. She has another 80 years to live. How do I know what the rest of her 80 years are going to be like? And it dawned on me in that moment how many people I had told this is going to be the rest of your life.
Wow.
And we know that medicine is advancing more and more. So how can I peer into 30, 50 years into the future and say what it's going to be? That made me feel incredibly uncomfortable. And I was setting these people up to essentially be in palliative psychiatry where they can't do anything but just kind of keep them comfortable.
Right. Sonia, what about you practicing traditional acupuncture and then moving in this field? What did you used to say before about functional root cause approach or data-driven approach?
Well, I've been on the receiving end of doctors like you who have said, "Oh, there's no research behind that." And I've always practiced root cause medicine because that's what Chinese medicine is. But it's for me, I'm actually very comfortable being, kind of being the outlier and being the person who's doing things differently than anybody else has ever done them. Because a lot of people think that acupuncture is all in your head, that you have to believe in it in order for it to work, and that there's not a lot of research behind it. And I'm going to tell you, if you have something that's been around for 3,000 years, that's the largest clinical study in humankind ever.
Hell yes.
Ever. So don't tell me that there's no research behind it or clinical proof behind it. Mm-hmm. So it doesn't really faze me when people are like, this is rubbish and it's all in your head and whatever. Because I'm like, I've been living with that for a long time. But I studied in China at a stroke hospital where they weren't using acupuncture to treat back pain. They were helping people recover from strokes. And that's real medicine. I mean, that's an application of something that we don't even like think about that here. Well, when my mom had a stroke, I was there the next day doing acupuncture on her, and she walked out of her hospital room 3 days later and got discharged. So anyway, so I'm very comfortable with being on the receiving end of like, there's no research behind this. Because what I see is when my patients are in front of me, they're saying, my doctor is wrong. I feel like there are natural ways that I can do this. I feel like the drugs aren't the only option. Right.
How could that be the only option?
How could that be the only option?
Does that make sense?
Yeah.
Can I chime in along these lines? Okay, so what they tell in Western medicine these days is, we call it CAM, complementary and alternative medicine. I will tell you, my humble belief is that pharmaceutical medicine is alternative medicine, because what you're saying, Dr. Senya, they've been using acupuncture for thousands of years. We've been using roots and herbs and food for thousands and thousands of years, and fasting, for crying out loud. I mean,
right. And pharmaceuticals, when was penicillin invented?
1940 was the first patient used penicillin.
80 years ago. It hasn't even been that long. So I'm a Chinese herbalist, and so the traditions and the knowledge of herbalism has been passed down. I mean, one of the books that we use is from 200 BC. 30% of the herbal formulas that I use that are on my shelf in my clinic are from that book from 200 BC. We still use them. They're so powerful. And I think that if the Chinese masters, if they saw what we were doing with pharmaceuticals, where you take one tiny, tiny active component and you make it into a huge, huge amount, and then you bomb your body with it, they'd be like, that's craziness. Why would you do that? When herbalism is about like naturally bringing your body back into a state of balance. People ask me, what are the side effects of using herbs? I'm like, well, if I prescribe it right, there won't be any. And they just can hardly wrap their head around that, because it's like, well, every pharmaceutical is going to have a list of side effects, and maybe you're adding another drug to help with the side effects of that. And it's like, no, with herbalism, there shouldn't be if you're prescribing it.
Funny? Like in evidence-based trials, a medication is considered to have a wonderful result if it's effective for 30% of the people 30%. Who take it.
That's a placebo. It's a placebo.
Placebo is close to 30%.
Yeah.
That's considered a good outcome.
Wow.
You know,
just have to show you guys, everybody is lighting up the comments too, thanking you, because what I'm hearing, and I'm agreeing with Irene here, saying we need more doctors like you guys that really care about helping us get better. You give us a better chance of living a fuller life. And I really am hearing that sentiment from you, saying you realized you needed to do more for your patients. You needed to treat them in a way that was treating their whole self and help them get well. So I'm just curious, do you see any of your colleagues on the conventional side starting to come around a little bit more and starting to, okay, what they're doing over there with functional medicine is really creating some results and maybe referring people to you? Are you seeing the tide turning at all? Start with you, Rob. Do you see that?
Yes, but very, very minuscule. Unfortunately, because the standard medical model is still diagnose and treat. And like Maggie said earlier, you know, if you don't do standard of care, which has been, this is what all these journals are telling us, which is basically pharmaceutical medication, you're going to get sued. You know, I have had some wonderful doctors, and I'm thinking of a nephrologist right now. She's totally into fasting. She's into watching, you know, these other alternative and complementary doctors doing things like that for kidney function. You know, it's sad. I've talked to some GI doctors and said, hey, you know, what do you think about leaky gut? They're like, oh, that does exist.
There you go, little man. There you go, little man.
Yeah. You know,
why don't you go levitate with your patients some more?
Exactly. But like, you know, I still work in the hospital, and this is where I see this is the saddest thing I see is all these poor people in America that don't deserve to be sick. And so hopefully, I think that I will tell you, can I mention the word COVID on this or not?
I just call it the big C.
The big C. I will say, I believe that one of the best things about that whole big C thing that we had for the last 2 years was that it kind of made people think outside the box, you know?
Yeah.
And funnily enough, you know, the standard Western doctors, they'd poo-poo on vitamin D and vitamin C and zinc and yada, yada, yada. You know what we were giving patients in the hospital? High-dose vitamin C, high-dose vitamin D, zinc, and so on and so forth. And we were just supplementing their immune system. So
thank you.
Yeah.
All right. I want to actually break into why this actually live came about was, I mean, almost once a month, you know, like I said, we talk to probably about 300, 400 people a month, but once a month, once a week, once a month, we will have a really heartbreaking story that looks like this. So I want to give you guys a common scenario, and I'm going to ask how many people out in the audience can identify with this story. So I have a woman who was in her early 50s, and she had rheumatoid arthritis, ulcerative colitis, and fibromyalgia. A year ago, she was actually on the verge, literally, of joining this program. Okay. And she calls her niece, and her niece says, no, functional medicine is a scam. It doesn't work. Don't do it. And she didn't join. Okay. Right. Literally, our own colleagues are doing this. And mind you, that person had no training in functional medicine, never even watched one of my videos, never talked to us, didn't understand anything a lick about what we did. 1 year later, this is about 3 weeks ago, the same woman calls us back, now ready to join the program. What happened? In her rheumatoid arthritis, her fingers now are permanently deformed to the right. Mm-hmm. Okay. Her ulcerative colitis, fibromyalgia, flaring like crazy. But worst of all, she got a new diagnosis now of lupus. Okay. And she says, now I'm ready to join the program. And I'm happy to help her now. But the thing is, for me, when I think about the autoimmune timeline, the sooner and earlier you intervene, the smaller the intervention you need, the cheaper that intervention is and the easier it's going to be to make a big difference. And the later you go, the worse it's going to be. And my question for everybody is, every time a case like this hits me, it makes me really mad at my colleagues. Because for me, this niece who said this to this woman, I like telling her not to do this. And now she has permanent deformity of her hands and a new diagnosis of lupus. And my question is, who is paying the price for her ignorance?
Right.
And we're not just doing this to our aunties, we're doing this to our patients. All of us doctors out there that actually see 20, 30 patients every day, and we're saying this stuff over and over again, who is paying for the price of your ignorance? And how many people out there right now have had these comments from their doctor or from their family members who are healthcare providers? I'm curious out there. I would love to hear your comments in the comment section. But I'm going to ask you guys, I mean, do you see similar cases like this? And because I really feel like in our medical profession, we take a Hippocratic oath, which is to do no harm. And yet, when we tell patients that there is no other alternative but the medication or surgery that they must do, and that's the only choice, and that nothing else, everything else is a scam, are we in fact doing no harm?
Right. I mean, how many people out there have been told by their doctor, your diet doesn't matter. It's not going to impact it at all. I've been told that by more than one physician in regards to autoimmunity. And what I've learned is that's just the farthest thing from the truth.
You know, to me, that's malpractice.
I agree.
Yeah, that is complete malpractice. I know a couple people who've been diagnosed with cancer. This one gal, good friend of mine, diagnosed with cancer, went to Stanford, not to bag on any university, but I mean, they're all the same.
Yeah.
They asked, hey, does the boyfriend asked the oncologist, hey doc, can she eat this? Can she eat that? The oncologist said, you can eat whatever you want. Doesn't matter.
I hear that so much. I want to kill these people, these doctors, because they're killing their patients.
Yeah, that's against the Hippocratic Oath, just to let you know, Maggie.
All the doctors?
Killing doctors, yes.
Damn it, Rob.
Well, I had that with one of my patients. I had a young guy, and he had ulcerative colitis, recently diagnosed, and he was very interested in coming to do, acupuncture and functional medicine with me. And he was also seeing a gastroenterologist at the same time. So he came in his first appointment. I'm like, okay, so here's what we're going to do to help you with this. And he then had a follow-up with his gastroenterologist who said, if you use that approach, then I'm going to fire you as a patient. You may not see both of us at the same time. You would do it my way or you do it her way. And personally, I'm actually I'm totally all for pharmaceuticals. Like, there are very appropriate uses for those. Lots of my patients are on them, and I want them to be on the minimal dose possible. And I really want to be helping them with the underlying root cause, so that they're not as dependent on them in such high doses. But yeah, he threatened to fire the patient. The patient was so scared that he was going to have ulcerative colitis for the rest of his life, and that he was going to suffer forever, that he never came back and saw me.
Well, when did it become us versus them? Because to me, standard of care, functional medicine is standard of care plus. Because what we do is we say, yes, you have all these standard of care options. I'm going to also discuss these drugs and talk about them with you. But why are they the first and only options for people? Mm-hmm. What we want to do is add all these other options and say, we're doing standard of care plus. It's not plus minus standard of care. Do you know what I'm saying?
Well, I think, and the functional medicine approach is, there's so much diet and gut related to that, but people don't know where to start because they're reading it they're reading it in magazines, and they're Googling it, and they're getting all this information, and they don't know how to personalize it. So they're trying keto, and then they're trying intermittent fasting, and then they're going gluten-free, and then they're going dairy-free, and nothing is really helping enough. So they think that none of it is going to work. And if physicians aren't, if healthcare practitioners aren't trained in how to personalize medicine, then there really isn't a whole lot that they can do.
I think what bothers me and what bothers so many patients out there about the conventional medicine approach, once you learn that there is this world of functional medicine, is conventional medicine, it seems like sometimes is just waiting for that organ to fail, or waiting until you're at a point where it's now we need to step in. Whereas the functional approach just seems like, okay, we're going to meet you wherever you are, and we're going to try to get you well. It just seems like common sense that would be the route that everyone should want to go with.
Can I tell you an example of my cat? I mean, this sounds really weird, okay? Because like a year ago, my cat had renal failure, kidney failure. They said stage 2 renal failure. And my vet said, oh, you're going to have to do all the stuff that he told me to do, right? And I researched it and I said, there's got to be a different way to do this. And I actually did my own functional veterinary research. I fed my cat completely a different diet. And yesterday, my cat had his creatinine check and it was 2.7 was a year ago. Right now it was 1.2. And the doctor said to me, well, either you're a miracle worker or the initial diagnosis was wrong, because I've never seen this happen in my 20-year career as a veterinarian, to see stage 2 renal failure in a cat reverse. And I was like, well, you haven't dealt with this pet owner.
Well, my question is, why couldn't that vet say, wow, hey, what you did was awesome. Will you tell me what you did so I can do this for the rest of my patients?
It's so true. And you hear that from other people, from human clients as well. Like if they take a functional approach and all of a sudden their blood work turns around and maybe antibodies go away, the doctor might say, oh, well, something must have been wrong with that original test, because we just don't see that happen.
Yes.
So it was a false positive.
Correct. They're discounting the actual results of functional medicine, which are stunning. Which leads me to this. I actually have the biggest objection that I see our colleagues have against a functional medicine approach to anything is they say, there's no data behind that. Okay. That is the big, I'm going to have you guys think that our top docs think about that objection and how you would answer that. And I'm going to actually show a video right now of what some of the clients who went through our program have to say about that. That objection is that functional medicine is not data driven. Stacia? Audio. This is the most personalized solutions that you're ever going to get, understanding your own data and the why behind your own autoimmunity.
I tried lots of things like many people have here, and there really is no certainty in it. It's a lot of trial and error. Yeah. So having that certainty through you and the results that are tailor-made for every person really has helped.
The thing that was really interesting was that to see that it was personalized to me. I had been trying, I had been recommended all these elimination diets that generally just left me crying.
I know I am better, and I can see the reasons of how I've gotten better, because now I know what tests to take and what the test results mean, how to interpret it, how to adjust.
Yeah. So that's what some of the clients have to say about their own results and their own data. So I'm going to ask you guys, I mean, we hear this from our colleagues all the time. There's no data behind what you're doing. What's your answers to that?
Why don't you start, Chris?
Well, I Googled functional medicine on Wikipedia in preparation for this. So I was kind of curious what Wikipedia was saying. So here's how they start this off. Functional medicine is a form of alternative medicine and encompasses a number of unproven and disproven methods and treatments. Its proponents claim that it focuses on root causes of disease based on interactions between the environment and the gastrointestinal, endocrine, and immune systems to develop individualized treatment plans. It's been described as pseudoscience, quackery, and the essence of a rebranding of complementary and alternative medicine.
That's what they're reading, and that's what our colleagues are reading.
That turns my stomach, actually. That really does.
Well,
what? That was written by Pfizer.
Well, exactly. And Robert, how are you going to answer that it's not data driven? How would you answer that?
It's very easily data driven. Just go to PubMed. I mean, any one of us, we're all smart people, and you don't have to be that smart. Although I will say sometimes it's difficult to parse through, scientific papers, but there are functional medicine journals out there. There's alternative medicine journals, studies after studies after studies. And, sometimes you have to be your own N of one. I know my labs changed. A couple of my patients who have run through my leaky gut solution program, they ask them to check labs before, during, and after. They don't usually do it during, but I've had people's kidney function improve. I've had inflammatory markers improve,
blood pressure,
yeah,
C-reactive protein.
yeah.
I mean, you name it, right? I mean, I actually think I do more testing now than I ever did as a conventional family medicine doctor.
Yeah. I think that, you know, the idea that there's no data has to start from the question of how we're defining data and how we're defining the study and the study type, who's being studied and what's being studied, what outcome is being studied. And so when we kind of stick to the strict study guidelines of a double blind randomized placebo-controlled style study, is going to be very hard to put the ideal of personalized medicine type of study structure. And so when we also incorporating things like wellness and optimal health into the equation of outcomes, that's not something you easily measure in those type of studies when you're just trying to see if a drug works. Those drugs are not designed in some ways to get a person back to optimal health and wellness. And so I think we're looking at two different outcomes in the study format. And so when they say there's no data to support that, is that we're largely looking to see a very different outcome, not just a reduction or a change in the lab value, but how a person ultimately gets back to loving, working, relating, working, and playing in life.
Happiness.
Those are the 5 criteria that we really want to ultimately see.
Absolutely. Well said, sir.
Yeah. It's so interesting to me because in Dr. Maggie's program, as I'm familiar with it, you know, she has this whole mindset factor to it as well. And it's so critical. It plays into all aspects of someone's life. And going through Dr. Maggie's program, I know when the alumni come out, they say they have gotten this master's degree in their own health. And what I'm understanding now is that that is more of an education in health than conventional doctors are getting in med school.
It is. It really is.
And so what do we do about that? It sounds like there has to be some sort of effort to change the way that physicians are taught.
Well, but here's the thing. Even then, that's true, right? But the thing is, I actually, when you look at the amount of data in our program, right, we're looking at all sorts of blood work, and not just the blood work, but there are blood work that the regular doctor is unwilling to order or doesn't even know what to do with that data. And then we actually teach people how to understand what we call the functional optimal ranges, not the normal at that lab, which is not optimal for humans. People don't realize that the normal range in most labs is what is the median in the middle of that bell curve. And who gets labs? Sick people. So you're calling the middle 50% as normal when you're saying the 50% of sickest people who get this blood work is what you should be at. And that's not optimal, right? So what we're talking about is all sorts of blood work that they would never even have access to, ever do. Their doctors have no training to do it. And even if they did do it, they wouldn't know what the functional optimal values were, number one. Number two is we're talking about hormone testing. I mean, I'm going to tell you guys right now, you know, in my program, hormone balance is the holy grail. And I'm going to be asking all of you to be super honest. How many of you have learned one thing in all your training, all your medical practice about the right time to test hormones, the right way to test hormones, what the optimal values are for hormones, or what the hell even hormone balance means, or are there even patterns that trigger autoimmunity? Be honest, you top docs. How much hormone training did you guys get?
I got, you know, most of mine through functional medicine training.
Prior to that.
Yeah. But prior to that, you know, not much. They would just say, here's the lab values. And if they're in this value, they're good. Like TSH, it's 0.45 to 4.5. That's an amazing range, right?
It's insane.
Yeah. So.
Right. And yeah, Chris.
Yes.
Hormones and mental health.
The first thing that comes to mind is kind of funny. So in training, if I started someone on the SSRI, let's say a man, let's say Paxil, and they develop decreased libido or erectile dysfunction, I wasn't trained to think, let me order a testosterone level or something like that.
Yeah.
I was trained to think, let's give them some Viagra.
Yes.
More medicine, more drugs.
No data. No data is the standard of care, everybody.
And if I'm going to think about other hormones like prolactin or so, I'm going to be thinking about it because antipsychotics can alter prolactin levels. I'm not going to be thinking about it as a primary entry point into thinking about a person's health, but as a consequence of something else.
And the thing is, Chris, a lot of people that you're dealing with bipolar disorder, schizophrenia, have underlying autoimmune issues or hormonal imbalances that's triggering it. And now you know. But we were never trained to even consider those factors. We're just trained, here are the drugs you need to take. Not just one, maybe 5, 6, or 7, whatever drug it takes. And yet those drugs themselves can cause hormonal disturbance, like you were just talking about, Chris. Not to even look at, that's what's an underlying issue that's causing it in the first place. But that's the thing is, actually, standard of care, think about psychiatry. There is no data is the standard of care. And then they're telling us that we're not data driven when we collect a shit ton of data and we actually understand how to use it.
Yeah.
Senya, what are your thoughts about data, especially since acupuncture isn't traditional in a field that use a lot of quote unquote standard data sets?
Yeah, because traditional Chinese medicine doesn't use lab work, but there's a very specific pulse taking method, and there's a lot that we do from observational work. And in fact, even in our functional medicine training, they say you can diagnose 90% of conditions just from an interview. And I think that's really fascinating. I spend 2 hours, Robert, he says he spends 90 minutes with his patients doing an intake. So we're really getting a lot of information from our patients when we do our initial interviews. So, so I think we're already getting a lot of data just from all the information we're getting from our patients. But then the great thing about the lab work that we do is we can find those underlying causes that are maybe hidden, that you can't get information from otherwise. Like, how bad of a gut infection do you have? How many gut infections do you have? Do you have leaky gut?
That's the real question.
Yeah, I mean, in Chinese medicine, you can't really get that from an interview. You need the lab work for that, or even adrenal function testing. There's some corollaries in Chinese medicine of adrenals. But when you actually do the lab work, I can read okay, you have very, very bad adrenal exhaustion. Not just your body's, maladapted a little bit. It's like, oh my goodness, your adrenals are tanked. We absolutely, we're going to spend 12 months fixing this, not just 2 or 3 months fixing this. And so I like that data because it gives us some objective information about the prognosis as well.
Yeah. So for me, I think one of the biggest things is that functional medicine absolutely is data driven. In fact, it's more data than conventional medicine. We have even more training than regular doctors do around this. And I think data is actually crucial. That's why also even food mapping, I developed the process of food mapping in my program. And I insisted on a data-driven approach to understanding which foods is actually triggering your autoimmunity. Not, I'm going to guess, and let's remove 90% of the food in your diet, right? So for me, even a process like food mapping, where our functional medicine colleagues are all about let's just eliminate more and more food from people who are already malnourished, poor digestion, autoimmune, sick, and then let's just eliminate more and more food from them, creating tons of food trauma and poor outcome. I differ on that in that I insist on even more data around no elimination diets, data-driven food mapping instead in our program. So that's something I really insist on, even more data. But let's talk about standard of care. And I would love to address this section about standard of care. Because, Chris, I recognize is in conventional medicine, that money model and how those doctors are reimbursed creates a model of where it's really just surgery, procedures, or medicine. But in the functional medicine world, there's also a problem when it's a money-making model, which is if you create dependency, people have to come back and buy your supplements or come to your visits over and over again. That is how you make money. Correct. So it behooves functional medicine providers and naturopaths to provide a dependency model where you need them for life over and over again. So it is actually working against me from a financial standpoint to teach people how to stop the root cause so they don't need me again, or they don't need to buy a supplement again. But we talk about standard of care in conventional medicine. There's also standard of care in functional medicine as well. And I think the financial models really determine that standard of care so much in both models, right?
One of the things that I've heard some of the docs, standard Western docs, they talk about, functional medicine. And don't get me wrong, there's good doctors, there's bad doctors, there's good functional medicine doctors, there's bad functional medicine providers, yada, yada, yada. But I've heard a lot of them say that, they just want to get you hooked on supplements. And, I'm with you, Maggie. I want to, my program, everybody's heard give a man a fish, he'll eat for a day. Teach him how to fish, he'll eat for life, or she, whatever.
Teach him how to fish. Yeah. And I say be the pilot, not the passenger.
Exactly. And so
Right.
what I do in my program, and, you know, again, like you just said, it goes against my bottom line in the long run, because I give people the fish, but I also teach them how to fish during my 12-week program. So when they're done, they know how to go on and live a healthy, vibrant life for the rest of their life.
Right. And that's the educational model, though.
Exactly.
And that's the problem is the standard of care in functional medicine isn't an educational model to actually help our patients how to fish for life. We're actually creating a model of dependency where they need your supplementation and your office visits for life in functional medicine as well.
Yeah. You know, I mean, the term physician means teacher, right? And
yep.
So go ahead, Chris, you have something to say?
In my world of psychoanalysis, we call what you just described as a projection. The claim that they just want to get you hooked on supplements is a projection, because it's in some ways what conventional medicine is actually doing, just getting people hooked on more and more medicines. And so, you know, the person that's cheating is going around accusing their mate of cheating. We call that projecting. So this is a very similar sort of phenomenon.
You always have something very astute to say, Chris. I never know what's going to come out of your mouth.
Awesome.
But what we're saying is that our conventional colleagues are saying, oh, functional docs just want to get people hooked on supplementation. But what I'm saying is, to some degree, I think both models have standard of care that creates a dependency model in some ways. But at the same time, I'm advocating for an educational model. And I know, Chris, you work really hard to educate your patients so that they have behavioral changes that last for life. Correct?
Absolutely. Absolutely. I think when I see somebody, I try to help them understand that first and foremost, like, their mind is a product of their body and a product of their environment and a product of their relationships. So when people want to pursue mental health, the idea that they're just going to talk to a therapist and change their thoughts or something like that and take medication is a very restricted and rudimentary sort of model. Yeah. And so we want to look at how their environment is functioning or not for them, how their body is functioning or not for them, their occupation, their relationships, and their overall spirituality. And that combination kind of focuses on, or is the kind of the substrates of mental health. And so I would hope at the end of somebody working with me that those things would be radically improved or a lot more in balance. And then they can be able to make more educated decisions of how to prevent such issues in the future, and not be in some ways dependent on the path just to help them cope. I think the ideal of coping is a detriment to healing. We want to cope until a cure comes. If we can somehow, or healing comes, if we can somehow establish healing, then I don't think teaching coping lifelong is a very effective model.
And I think that's where the Western medical model really, like, they really focus on, well, you're going to need to take this medication forever. You're never really healing the problem. You're never really curing the underlying cause. And so, of course, you'd have to take the medication forever. You're not fixing it. But when you're actually doing healing, when you have personalized medicine, when you're getting to the root of it, you heal the issue so that it doesn't come back. And I think in what, like, a Western physician, when my husband's a Western physician, so we have many conversations about such things.
Still married?
Arguments. I mean, there's definitely a lot of conversations we have. But he didn't really he didn't really know that I could heal people, and he was an ER physician. And after I was in practice for 3 months, he said, "Wow, when people come to see you in 3 months, like, you turn their life around. Like, you actually heal them. They get better." I'm like, yeah, that's why I went into this.
Duh.
And it blows his mind, because to him, you just put a Band-Aid on it, another Band-Aid, another Band-Aid. You know they're going to keep coming back. So when people say, like, you're going to be dependent on supplements and whatnot, that's the pharmaceutical model. If you're prescribing the right supplements and you're personalizing the treatment, you heal, and then you don't need those things anymore. But they can't wrap their head around that, because that's not their paradigm.
It's so fascinating to me too. I want to hear from you guys. You mentioned you're actually working to heal them. You're turning their lives around. How many of you have had clients come to you who perhaps you think have been avoided even surgeries because you've been able to address some sort of cause that they were maybe headed down that path and a physician told them they needed a surgery, but you were able to avoid that? Has that happened?
All the time.
Yes.
That's oftentimes what patients' goals are. I don't want my gallbladder removed. I don't want to have part of my colon removed. I don't want to have
my thyroid removed.
thyroidectomy.
I don't want my uterus removed. You know, I don't want anything removed. Like I don't want to have this eye surgery, right? Or this dental implant. This all happens all the time. I mean, and that's why I think, to me, case studies are really important. When people talk about evidence-based medicine, I mean, we have right now published over 150 video case studies of clients. And many of them have said, I have avoided this surgery. I've avoided that surgery as a result of it. These are real cases, real people, real outcomes. The other thing, what people don't realize is the toughest cases come to us. The toughest cases in autoimmunity comes to me. You know what, because we're talking about like people go and they say standard of care of Johns Hopkins, Mayo, Stanford. You guys are talking about this. You know who they come to after that?
Us.
Yeah.
Us. Beat the Mayo. I play Beat the Mayo all the time being in Minnesota.
I mean, I have a case recently, a case study where POTS, let's just use POTS as an example. POTS, an example, in the conventional world is a cardiologist's problem. So meaning like there's something wrong with somebody's heart. Let's have you go see a cardiologist and let them give you heart medications, which are typically blood pressure medication, beta blockers, that will slow down the heart to prevent the fast heart rate, but it drops their blood pressure more. So they're coming to you because they're fainting, they're dizzy, they're nauseated, and the blood pressure's already dropping like crazy. They can't work, they can't drive, their lives are totally screwed up. They go see a cardiologist who gives them medication to drop their blood pressure even more, right? And that's the standard of care at POTS Clinic at some of these facilities that I just mentioned. And then after that fails, they come to me. This is 6 years later, $60,000, $600,000 later, 3 years of lost work later, right? And so for me, we get the toughest cases, but at the same time, they're not even hard cases for us to solve. Like, seriously, POTS? I eat that for breakfast. Give me something else for dinner. Like, come on, bro. And we have like case studies after case studies after case studies of results from these impossible to treat diagnoses from these centers that really don't do anything to help these people permanently at all. Oh, there's a video.
Oh, POTS symptoms are gone after the second week.
As of last week, that my POTS symptoms that I came in with, which is a form of dysautonomia, have been gone since week 2. I'm surprised it took me this long to realize it, just with other symptoms and stuff going on. But it was really just mastering my blood sugar, I think. That really helped with my POTS symptoms, which I know many people come into the program with. So I'm really thrilled about that.
POTS, postural orthostatic tachycardia syndrome, is basically one of those mystery diagnoses that's really hard for people to diagnose. But even once you get the diagnosis, there really is no good treatment. People will go to Johns Hopkins Mayo Clinic and they take blood pressure meds to slow down the heart, which drops their blood pressure more, which makes their dizziness and fainting worse. There is no good treatment out there for POTS. But Dana just said something here that's revolutionary. What did you say fixed the POTS?
Sugar balancing.
It is absolutely a blood sugar balancing issue. And nobody out there understands this. And that's why just in week 2, she's already turned it around. And this is the kind of thing that literally ends careers for people. At the age of 26, she figured this out by week 2. Congratulations. But that's, I mean, that's typical case, Rob, and you as an internist, how many cases of POTS have you seen dealt with in a hospital setting, in an emergency room setting?
Hundreds and hundreds and hundreds, and they're all started on meds. They're all started on propranolol or something like that. And then they wonder why they feel like shit all the time.
Standard of care, dude. And not one standard of care physician have done additional testing, hormonal involvement, or trained themselves in realizing it's not a cardiology problem. It's actually an autoimmune related issue and it's a blood sugar related issue. Boom. And in 2 weeks, I could do what somebody in 6 years can never get results of. That's what I mean when people truly understand with real life case studies. When people are like, have you published? Oh yeah. How about 150 plus 200 case studies? How many would you like? How about 2 a week of results that you never see anywhere else? Right? That's the kind of thing where people need to understand is that there are thousands and thousands of people every day that are getting these out of the box results as a result of addressing their root causes. That's evidence.
Well, I'm curious to hear from each of you doctors, what does this feel like for you to know that you're doing all you can now to help these patients and these clients in a way that perhaps you weren't before, but so many of your colleagues are still poo-pooing on your approach, or, you're feeling for these patients who just aren't getting that help. What's the feeling like when you think about all of those many patients out there who aren't getting the help that someone like you and these other providers on screen can provide? Rob?
It's saddening. It really is. There's many times I almost come to tears describing the patients and people I see, and it shouldn't be this way to me. Like, we don't deserve this as human beings. Our God-given bodies are absolutely genius, and they're really screwed up because of what we're doing to them, with our crappy diet, our, reliance on technology, social media, all the chemicals in our food. And, it's really sad to me. It's terrible.
Senia, your thoughts?
Well, I actually have a pretty optimistic view of it, honestly. And that is because I've been in the field for 14 years. I've been a practitioner for so long. And when I very first started, the only people who came to see me for Chinese medicine either were hippies, so they were always doing acupuncture was something they always did, or they had gone to the Mayo and the Mayo couldn't help them. So they either were desperate or they were hippies. And then that's when they would come in. People still wanted the magic pill. They still wanted the silver bullet at the time. So that was back in 2007, so 15 years ago. But then I've actually seen it change a lot in the last 15 years. And some point halfway through then, people started realizing that their diet made a really big difference. Gluten-free became popular. Doing paleo, keto is a recent thing, intermittent fasting. And so I've seen, like, in the last 7 or 8 years, most patients who are coming in, they've done something on their own. Their doctors haven't helped them at all, one lick. But there's enough information out there where they've started to implement changes in their lifestyle and their diet, and they've seen improvements, and they recognize, like, I'm not an expert in this, and in order to get where I need to go, maybe I need some expert help. And so I've really seen the trend change a lot, where it's like, it doesn't really matter what their doctors say, because they're starting to realize I'm in charge of my own health, and there's things that I can and need to do. And so part of the reason I went into functional medicine was because I think it's the medicine of the future. And I think 20 years from now, this is what everybody is going to be doing. So even my husband, who's an emergency physician, and he saw the work that I was doing with Chinese medicine and how much I could heal people, he actually went and got functional medicine training. I talked him into it somehow. Cool. And at first he was saying, he's like, I think this is snake oil. He's reading the book about, like the introduction to the textbook. He's like, this kind of sounds like snake oil. I'm not so sure about this. And I convinced him to do the training. And I didn't go with him. I actually joined the training later. So he went to functional medicine training first. And for the first 5 days of training, I talked to him every night on the phone. And the first night he was like, wow, maybe it's all about inflammation. And then the next night he's like, this is really interesting. The gut has a lot to do with this. I had no idea, but yeah, but each night he was like, yeah, but I'm not really sure. By the fifth day, he said, I can't practice medicine the way that I did ever again. Yeah. I can never look at the body the way that I did before, because this makes so much more sense. And I'm sort of like snickering a little bit, because I'm like, well, this is how I've always looked at the body. This is why I practice Chinese medicine, because it's very holistic. But once he learned more about it, he was completely sold. So he actually changed his specialty. He no longer is an ER physician because he's got sick of putting Band-Aids on things. So now he does something where he's helping people get better every single day. So he's actually helping to heal people. So that's a major win in my perspective.
He deserves you.
That's right.
I
put on the shirt to convince him that the holistic method is the best way to go.
I mean, I actually see the same thing. Actually, Senia, I actually do have a very Pollyanna, maybe optimistic view. But the thing is, it's fundamentally based on the fact that I actually teach my clients in our program how to actually talk to their doctors to invite collaboration. And so the conversations, honestly, and of course, I teach how to do that conversation without going, there's a lot of nuances to it. But the vast majority of responses from people as they graduate our program and they're talking with their doctors is a positive one, meaning their doctors are like, yeah, I've heard about that. Oh, I'm so glad you're on that. I'm so glad you're on that. Or yes, I'm willing to order the labs for you. I'm getting that more and more. And I think because I'm teaching these people how to speak and advocate for themselves. It is evidence driven. Most importantly, results speak louder than anything. If they go into the doctor's office and they go, here are my thyroid labs, here's my hair loss, here's my goiter. Do you see all this smaller and all this stuff? I just lost 30 pounds. Will you work with me to keep this going? This is what I did to do with it. The results is actually what is speaking to our colleagues, and our colleagues cannot deny this patient they've known for 10 years with a very different outcome, right? The good ones anyway. So I'm finding that the vast majority of our colleagues are responding to my patients' results and their invitations for collaboration.
Yeah, I think that's going to be, I think testimony is going to be the greatest evidence.
Yeah.
Because as people, one of our most primitive defenses is what we see. We can read something, but if we don't see it, it doesn't really become real. And so I think the live testimony of people is the most crucial element to telling the story of healing. And I think if we talk about it like we are right now, it's not the same as somebody seeing it in the flesh. And I think the more and more that gets out there, that will be the more telling aspect of it. And hopefully the debate and things will die down. I think for me, this journey has been helpful and transformative in growing in my own spiritual journey. I'm Christian, and I've always heard about healing in my family and the church, but I had never seen healing before. And so this in some ways was challenging my faith about what God was and Christianity and things. And I can see how some people come to all kind of theologies when we don't really have an adequate sense of healing in our culture. And so for me to be able to see people improve and heal now, it's been very transformative. And it makes me in some ways question, how did the medical system become so sadistic in a lot of ways? And, many of us come into this field all, bright-eyed and red-faced and blushing about getting into this field and helping and things. And over time, the field in some ways morphs us in such a way to become callous and hard and sadistic in some way. And I just feel that it's something in me that feels so incredibly uncomfortable to tell a person, you're not going to get better. You need to just accept this, and this is how it's going to be. It's something feels so sadistic about that. And I think that I do have compassion on physicians because I was once there doing that.
Me too.
And I think that we all in some ways bought into our leaders out of loyalty. The culture of medicine is in some ways a culture. And so all cultures have rules that you have to follow. And you don't know a lot as a student to question and go against the grain. And you're tested on what your leaders say is the right answer. And so you have to kind of go along with that. And I think in some ways, when people kind of feel more confident to be able to do the work of looking at what has happened and how they participated in it and not feel so much ego bruising that they might be wrong and embarrassed about that. I think, it's a great opportunity moving forward.
An opportunity. I just want to tell all of you that in the comments, there are so many people expressing their gratitude for everything that all of you are doing. You truly are changing your patients' lives in a way that probably would not be possible if you were just utilizing the tools of conventional medicine, as we've seen. So thank you so much for doing everything it is that you're doing and for spreading this message and teaching others about what it really is like to get to the root cause and to take that approach and how that can truly transform someone's life. Dr. Maggie?
I actually want to remind everybody here, interestingly, is that I have actually great hope for the medical profession. And the reason is all the medical profession that's around me today, these are all doctors who practice in a conventional way in their field before actually getting this education, paying on their own dime with their own time to actually do this against the grain. It's an incredible act of courage and investment in themselves. And what I'm seeing as well in the program, at least 10, if not 15% of the people joining the program, Anne, are medical providers. So this is the thing is when doctors or nurses, respiratory therapists, when they get sick themselves, do you think they're running to the conventional doctor? They're coming here. Like first, so it's for me, I do see a huge tide. I see hope in my colleagues that are here. And I also see hope in literally the hundreds of medical providers that are actually going through our program and have gone through our program over the last 5 years. So I think there's great hope in the profession, but I really wanted to shed light and actually have the public see what it's really like behind the scenes of why we chose to be in this profession, what we forecast as coming out, but also I want access. I think all of them out there should have access to this information. right? This is why we're having this open discussion about this. I want them to access this information. So for people who want to learn more so Dr. Chris Winfrey practices functional psychiatry. He's out of New Jersey. Look him up. Dr. Robert Floyd has a metabolism program, online program. And Senya, you've got a practice in functional acupuncture out of Minnesota.
You betcha.
Right? You betcha. And so this is going to be your hot dish for the day. All right, everybody. Thanks a lot. And my parting thought is I would love for all of you that are watching right now, what was the one biggest aha that you have? What was a shocking piece of information that you learned? What was something you didn't expect one of us to say? Type it in chat right now. Also, if you think that you have something that could benefit from a functional medicine approach, type it in chat right now. I would love to hear what that is. You could get some feedback. I have a lot of alumni who are watching this right now. They're my student teachers in chat who could be answering questions right in our comment section as well. If you want to learn more about what it's working with me and our team on a functional approach to autoimmunity, I'm putting a link there in the comment section for you to just have an online chat with our team or book a call with us. But the other thing is, any of you that have commented, I really advise you to check your message request maybe in a couple hours or tomorrow morning, because there will be a message from us asking to learn more about you and to share. We have thousands of resources, interviews, trainings, case studies to be able to share with you. I want this information accessible for everybody, but we're not going to be able to get it to you if you don't raise your hand. So go ahead in the comment section, raise your hand, tell us more about you, and we'd love to get to know you more.
All right, an illuminating discussion, certainly all about how functional medicine really is the key here to so many people, and it is creating results despite what your doctor might try to tell you. Thanks so much, everyone, for joining us for this Autoimmune Table Talk Live. We'll see you next time.
Thank you so much. It's been an honor to be here.
Thank you.